Welcome to the AM News. Let's get right into the details, starting with Chairman of Parliament's Health Committee, Dr. Nana Ayew is demanding an immediate intervention for the grant of waiver to enable authorities at the Komfo-Anokye Teaching Hospital clear consignment of the pots. The goods, made up of tiles meant for the renovation of old blocks, are currently under demurrage as a result of delay in payment of their duties. Attempts by the facility to get government approval waiver have also not received the necessary attention. Dr. Nana Ayew says the waiver is long overdue and must be approved due to its critical nature.
Waiver is supposed to be given by Parliament, tax waivers by Parliament, by Finance Committee. We've demonized waivers to look like giving waivers is so evil. Waivers is more of like telling government to go and pay for. But then government is supposed to go and do 2 million to pay itself. And government is saying that grant them waiver. If I take the taxpayers 2 million to go and pay to clear goods for Komfo-Anokye, I'm taking it from the taxpayers' money. If I had 10 million, I've taken 2 million to pay for Komfo-Anokye. You understand? At the same time, let me give waiver so that I can still hold to my 10 million. The opposition has made and the society has made people to think like waiver giving is evil. Now government institutions that must be able to get waiver. The posture of the Finance Committee in Parliament is more of we are hostile to waivers.
Now that the situation has been drawn to your attention, what do you intend to do? Because Komfo-Anokye is not only for the Ashanti region.
The onus is not on the Finance Minister, the onus is on Parliament.
Has it been drawn to your attention in Parliament?
Absolutely. This issue is there and we have to be able to grant them waivers.
How long has it been there?
When we come to Parliament to do emergency sessions, we just have to grant them waiver.
So they are raising against time.
We don't have to demonize waivers. Waivers, we are positive and good, especially when it's going to save the taxpayer. Your own money that you are going to dole into something. If waivers is going to save you from your own money and just put that cost as neutralized, then what is wrong with it? So we need to stop this attitude.
Are you calling for an immediate granting of waiver for this project?
It makes a lot of sense. I mean, this is common sense. I don't have to say it. We have to. Yes, we have to.
The Pharmaceutical Society of Ghana is alarmed about a shortage of pharmacists in the 5 regions of the north. According to the society, the situation is impeding the progress of healthcare delivery. President of the Pharmaceutical Society of Ghana, Dr. Samuel Donko, raised these concerns when flag bearer of the NPP, Dr. Mahmoud Bawumia, met the society on his bold solutions for the future engagement.
That in the past 3 years, the government has not employed pharmacists into the public sector. And that has not happened because of financial clearance issues. If we are producing pharmacists every year from the various universities, and yet the government is not employing the pharmacists. These at the same time we have, when you go to the various hospitals across the country, go to the northern zone of Ghana, all the northern regions put together, the upper west, upper east, there is a manpower shortage or the shortage of pharmacists in various hospitals and clinics around. And that's why we raise the issue that this is an issue that can be tackled. We need a financial clearance for many more pharmacists to be employed into the public sector.
Dr. Mahmoud Bawumia says the demands by the Pharmaceutical Society of Ghana align with his policy direction. He assures to transform the sector if elected president.
Ghana has a comparative advantage in the whole of the sub-region in the pharmaceutical sector. We do. There's no doubt about it. Ghana has a comparative advantage, and therefore we should be. If we want to be the pharmaceutical hub, which I want us to be, then we have to put our money where our mouth is to support local manufacturing. Without that support, we are not going to make it. The good thing about the pharmaceutical industry is that the demand for the products is there. 70% of our needs are imported. So the demand is there. So funding this is not something that you're going to fund and then you are losing money, because there is a demand for the product. And so we are going to really, I'm very supportive, whether it's through EXIM or another vehicle. I think if once we have made the decision, and it will come in my manifesto, by the way, that we are going to make Ghana a pharmaceutical hub, but you cannot do it without funding. It's the same way that I want to establish a minerals development bank for the miners, because we can be, the major, mining hub in Ghana, especially for the small scale miners, with some support. But we need a financial institution that understands the business of mining to support them with machinery and so on. But so for me, I believe that once we have made the decision, which I've made, that we are going to make Ghana a hub for manufacturing in this sub-region, then you have to support it with the financial resources. And I think the gain from that would be huge for Ghana. And I think we should do it because we have a comparative advantage.
In other stories, recent data from the International Development Research Center based in Canada has revealed that women constitute 28% of researchers across all fields in Africa, with an even smaller percentage entering STEM-related fields. The report also highlighted a significant shortage of women advancing to leadership roles in STEM. The center has been highlighting the challenges women face in the bid to take up roles in STEM. There's more in this report.
The research conducted has so far identified that some women in Kenya and Ghana have been able to enter STEM fields and progress to leadership levels. These women, according to the research, have done so because of factors such as personal interest, family background and support, as well as institutional factors such as networking. Speaking at the workshop, Senior Research Fellow for Environment and Sanitation Studies at the University of Ghana, Dr. Adelina Mensah, indicated that the goal of the project is to collect information to guide policy and interventions towards ensuring women's career development.
Our project is named Sisters, which is an acronym for what we are focusing on in terms of transforming institutions to advance women leaders, especially in STEM careers. So a lot of information is available, or there's a lot of research that's been going on in terms of women's representation in these fields. But our specific focus is how do women actually progress in these fields to enter into leadership or managerial positions, because you may have female representation within an institution, but then the numbers may be low, but then the positions that they occupy will be at lower levels than higher levels. So that's the main idea behind this particular project.
Head of Department for Geography and Resource Development, Professor Charlotte Asante, highlighted some challenges that women face and encouraged them to take up roles in STEM education.
So, for instance, gender stereotypes and biases, and the whole issue of balancing, the work-life balance, how to navigate between motherhood, women's role as mothers, their roles as wives, and then balancing that with their profession is one key challenge that came up. Another key challenge is the resources, the very limited resources, particularly in particularly in academia. For sciences, you need resources. For instance, laboratory, you need funds to do research because you also have to publish, and without those resources it becomes very difficult. Coupled with their heavy teaching loads, it becomes very difficult for women in particular.
The project's ultimate goal is to collect information to guide policy and interventions towards ensuring women's career advancement. Karen Obein's report, read to you.
Now, a culture of silence has descended on the industrial area of the Asokwa municipality in the Ashanti region. Residents say air pollution from some industries in the area is making their lives a misery, but they have been warned that speaking up may cost them their jobs with government and companies. Love FM's Mona Lisa Frimpong explores the situation.
A solid waste scavenger sits at the Oti landfill site in Kumasi. He worries every day about his exposure to harmful substances from waste materials here. He's asked to keep his name secret for reasons that will soon become obvious. The man in his 30s is frail and sickly. He wears no protective clothing as he sorts out recyclables. The man says he's battling headaches, coughs, difficulty breathing and tiredness. He attributes his poor health to the inhalation of hazardous substances from the solid waste. His last hospital visit revealed a respiratory infection, but he has no money to follow up.
Last year, I'm in hospital. I'm a because ball and cent, it be too much. Oh, serious, nicely. Ball and cent, Also, the morning I'll put you I'll take it, ball and cent.
Medical practitioners have advised him to switch to a different job. But the man says with no formal education, this is his only choice for a livelihood. Scavenging is a source of income for unskilled people in most developing countries. A study by the Journal of Environmental and Public Health in South Africa found health complaints and injuries are common, including respiratory infections, headache, diarrhea, and shortness of breath caused by polluting gases like methane and carbon dioxide. But the true extent of problems at the Oti landfill is impossible to assess. In every step of our investigation has been blocked by management. The Oti landfill facility is one of the largest disposal sites, receiving about 1,500 metric tons of garbage every day from Kumasi and its environs. Its location in the community has provided informal jobs for residents in the community, from garbage collection, scrap dealing, and scavenging. We tried to talk with other scavengers at the Oti landfill site, but management of the facility refused us entry. Informal workers inside the facility refused interviews, saying they feared being targeted by the company. But those who did agree to speak off camera revealed headaches and migraines are common. Kwame Lucky did agree to speak on camera. He has pitched camp close to the landfill site. After receiving garbage from the dump site, he airs it for 3 days to reduce the odor before sorting out scraps.
Everybody move for us and sent here the womb. Until my yamani basi ya unse yamani big gugu esruho. Ye the gugu man from money the FA society. Just from never so 3 days going to 1 week. Na sent ni nede. Na afrim. Afirine assistant ni nede. Hadi aba selesi hurumu han misede. Aba beye hujum. Management of the landfill knows about the problems. 2 years ago, the site was redesigned to reduce environmental damage and eliminate hazards that the garbage was bringing to the community. But residents of neighboring communities of Dompase and Oti say the overwhelming smell from the site and their continued poor health shows more needs to be done. Former assembly member of the municipality, Elliot Bano Fusu Jr., agrees.
When it rains, the air that comes from the landfill site into the community is very bad. We don't breathe good air at all, I must be frank. And it's having health effects on the residents. There's a community clinic here. I initiated it as assembly member, that's Lady Julia. The residents always frequent there. The residents have been going there with related problems, health-related problems associated with the, what do you call it? Breathing or pollution of the air.
I'm a few meters away from the Oti landfill site, and residents here have complained that the air quality of this area is not so good. This area is part of the Aswa municipality, which is the industrial hub of the Kumasi metropolis and even the Ashanti region in totality. Researchers from the Kwame Nkrumah University of Science and Technology have conducted a series of research which proves that this place remains one of the most heavily polluted places in the Ashanti region. Healthcare facilities in the area, the Lady Julia Health Center, Kumasi South Hospital and other health facilities refused to comment on the incidents of air pollution-related illnesses in the municipality. Off the record, staff told Love FM they were afraid of being politically targeted for talking to a journalist. But former Assembly member Bano claims that healthcare facilities in the area record high cases of respiratory infections.
Sometimes the air is also polluted as a result of smoke from the landfill site. It is recently that it has calmed down small. Formerly, when they just they put fire into the sawdust that they have been bringing to the landfill site. So the atmosphere become dark. Then we breathe in smoke. So it also have effects on us. Talk about complaint. We have been complaining for the past 10 years.
It's not just the waste dump that is causing air pollution and sickness here. On a typical day in the Asukwa municipality, a haze hangs in the air. The municipality is the industrial hub of the Ashanti region with oil, wood and food processing companies situated alongside the Kumasi Abattoir Company Limited. Before 2020, meat was often roasted over car tires and wood. Butchers burned furs in open fires producing thick black smoke. Butchers reported high rates of respiratory infections. In 2019, then Sanitation Minister Cecilia Abinadapa banned the practice to stop the harmful effect on the health of consumers and residents. Butchers have switched to the use of liquefied petroleum gas to singe the furs.
The time that we were using the tires, even that time the smoke was entering us more. Even sometimes the breathing, or even when you cough, you see the level different from now that we are doing the gas.
First day night, then yet the BIM or your Tambia to when it's a boy.
Tano ukoma unsi ekọ hunu eno waso kwa kwa dwale won yire ho ntwetwe ho yi a aje chabia o yakpo hosia na ni na ewo.
While government will not release details of air pollution in the area, a group of scientists and other experts measured the air in October 2023 as part of the Clean Air Summer School held in collaboration between the University of Leeds in the United Kingdom and the Kwame Nkrumah University of Science and Technology in Ghana. Air sensors mounted at the Oti landfill site and the Kumasi Abattoir measured air quality over several days. At the landfill site, the air pollution exceeded the World Health Organization's guidelines for what's known as PM 2.5, the most dangerous air particles all day, every day. It also exceeded Ghana's less stringent guidelines for several hours a day. At the abattoir, the sensors found the air was unhealthy for a third of the day. These high levels of air pollution are harming the health of residents, according to medical coordinator for doctors in business organizations and public health consultant, Dr. Florence Buampunsim.
It has to be a consistent exposure to it. So if you have been in a particular area and you've been there and it's constant inhaling of these gases that are emitted, that's when you can have these effects that some of these effects that I'm about to talk about. So there's respiratory issues where you have upper respiratory issues, breathing problems, coughing, you have irritation and things like that. We also have cardiovascular problems, okay, which causes problems for your heart in long term. But all these things I'm talking about is long-term exposure to these gases.
The research team presented these findings to management of both the landfill site and the Kumasi Abattoir Company Limited in October. A month later, the production manager of the Kumasi Abattoir, Michael Tongban, denied the research team recorded high levels of air pollution at his facility.
Some people came from KNUST, came and did conduct research on air pollution. It wasn't bad as we are talking about. Understand? And you know, this place is part of industrial area. We are not isolated. There are industries all over here. You understand? So air pollution is minimal here.
Management of the Kumasi Abattoir Company Limited refused to speak on the findings. But days ago, a scientist of the research team revealed the Kumasi Abattoir Company Limited reached out to them privately for a collaboration on how best they can control or prevent air pollution in the facility. In an interview, Municipal Health Director Faustina Osei-Mensah conceded that respiratory infections are second on the list of health issues recorded in the area, but Director Mensah played down the threat from industry. Instead, she blamed cars.
With acute respiratory diseases, we encourage them, if you had infection, just put on your nose masks. And we encourage them to report to the health facilities as soon as they see the signs and symptoms. There are a lot of activities that are going on. And this area being an industrial area, we have a lot of cars that are moving in, out. The whole place is choked. Human traffic is also going on, and vehicular traffic is also going on. So a lot of activities are going on, especially with cars. People are using cars, and the fumes from their engines are spreading all over. That they are all giving us infection. And if you look at the factories, we have factories, and the activities that are going on in the factory, we visit them, advise them concerning their burning of their waste.
But now, the municipality has been found to have high levels of air pollution. Director Mensah said the government is embarking on sensitization programs to combat human activities which contribute to air pollution. In the meantime, Dr. Florence Bwampunsim advises workers and residents in light industrial areas like the Asokwa municipality to protect themselves.
And most of the time, those who are even working directly with these machines are in protective garments. But I'm even going as far as people who live by these machines, because sometimes you feel like you live by it, so you don't necessarily have to, you don't live it, but you are inhaling it, do you get it? So I would advise people who actually live by big industrial areas, big industrial machines, to make sure they wear their nose masks consistently.
This story was a collaboration with New Narratives with funding from the Clean Air Fund. The funder had no say in the story's contents. For JoyNews, Mona Lisa Frimpon reporting.
Now for our final story for this bulletin, the Perfect Peace Foundation Ghana, housing over 500 orphans and neglected children in Amakom in the Ashanti region, is recounting financial challenges in managing the charity home. Authorities say the situation has affected the operation of the facility. The situation is being mitigated with a donation from the Abochie Fan Club, providing a month's worth of food supplies for the orphaned and vulnerable children. Here's the report.
Situated in a small neighborhood at Amakom in the Kumasi metropolis, the Perfect Peace Foundation, since 1991, has been offering support and fostering children without parents and from strong, vulnerable backgrounds. These children are being supported in basic, junior and senior high school and university education in Ghana. But the running of the foundation's charitable activities is hard hit by the country's economic challenges. The administrator of Peace Perfect Foundation, Kofi Mensah, says the increasing number of inmates is overstretching the facility's budget and finances.
We also need financial support because as we speak now, if some of them fall sick, we are to send them to the hospital, and all these things we need financial support. Sometimes they have issues, health issues that we are also looking after.
The Abochie Fan Club commemorated its 1-year anniversary by donating bags of rice, boxes of tomato paste, cooking oil, and other items to the orphanage. The intervention is to help mitigate the struggles of the orphanage. Rosina, a champion who spoke on behalf of the club, says the gesture forms part of the club's designated mandate.
nhyira so abeto ebubrokosua ema eso ye niema ye de ba orphanage no ye hu ni se orphanage no sebi nipa wote orphanage no wono so hia moa efri afoforo.
Speaking in appreciation of the gesture, Kofi Mensah indicated that the food supplied will keep the beneficiaries fed for over 4 weeks.
We are very happy to have Abochie as a foundation to come and donate these items to the orphans and needy in this premises. These items could take us about a month.
The Abochie Foundation is a social support system for young men and women to provide financial and social support for each other. Founder of the club, Nana Ama Kwatima, is admonishing public support for social organizations to heighten their impact on society.
Enyema we nyina ye no e aboafo bi e na so ya sene e na yeso ye mode bokakra e ka ho enti ese ye brie po ato so bi biara opese obeboa ye bia no obetima ba beboa Abochie na ye duru ye botaye e ho Abochie ye pon ye bie se ye pe members a omo hojo a omo di omo huni so mba be kan ho ti we wa ye ready bia so opese obejoin bia obetima ba.
Reporting for JoyNews, my name is Clinton Yemwa.
That brings us to the end of the AM News. Up next is the news review. Our guest is already in the studio, so let's get into it. Stay with us.